We all experience pain in our bodies from time to time, but for some folks, that discomfort is constant, lasting months, even years. And how do you know when it's time to seek expert advice? In this sponsored segment, Gabrielle Pfeiffer gets the answers from a doctor at Integrated Pain Solutions in Columbus.
I am joined by Dr. Walega. He is a physician here at Integrated Pain Solutions, and he is going to help us understand our symptoms. Nice to meet you, Dr. Walega.
Likewise, Gabrielle.
You have been in the practice for years, over 20 years? So you have dealt with a lot of different patients, a lot of different experiences. What kinds of symptoms are you hearing when they come in and see you?
There are a variety of different pains that patients are going to come in with, and that is, hey doc, I can't function. I'm having trouble getting through my daily activities. I'm not able to work, or I'm exhausted just dealing with my pain on a daily basis. When we pick at chronic pain a little more deeply, we often see social isolation, difficulties with sleep. There is a tremendous coexistence of depression, anxiety, low self-esteem when patients have chronic pain that's negatively affecting their ability to function on a day-to-day basis in the workplace, in the home, in the community, and just being able to take care of yourself.
So there's chronic pain, and then there's also acute pain. Can you describe that?
Sure. So acute pain is pain that typically occurs after a known injury or illness or surgery. Examples: rollerblading, you slip and fall, you break your arm, of course that's going to hurt. Patients who have a surgery, let's say they have appendicitis, they have an operation to remove the appendix, they're going to have acute pain from that appendicitis. They're going to have a little bit of post-operative pain for a couple of weeks, and over time that's going to get better as the body naturally heals. Chronic pain is a little bit different. Chronic pain are these pain symptoms that are occurring despite the illness or the injury having had plenty of time to heal. We usually say the 3-month mark is the key turning point of acute pain turning into chronic pain. So you wake up, you twist and lift at the gym the wrong way, you hear a pop in your back, you've got bad back pain, pain shooting down the leg, that's acute pain. 3 months, 6 months later, when you still have that problem, that is chronic pain. And that's when things get more complicated because all of these other issues start interacting. The sleep disorder, I can't function, I'm missing work, I'm going to physical therapy and I'm not getting better, or I've seen multiple doctors and I'm not getting better, and it's starting to be a financial burden which is stressing me out. And that's how chronic pain becomes a harder issue to treat.
Many people resort quickly to medications, but that is not always the solution, right? Can you explain conservative therapies and the benefits of that?
Although there's a time and a place for medications, be they anti-inflammatory medications to decrease that acute pain syndrome, or muscle relaxers to treat some of the secondary muscle spasm symptoms, and occasionally stronger painkillers. An approach that goes more into focusing on the physical function. What's the problem? What's the problem in function that we need to address? And many times we can deal with a chronic pain problem with physical therapy or certain injection treatments that avoid our use of medications that people would take every day, or medications that would cause side effects or other health problems or health challenges.
Here at Integrated Pain Solutions, you all offer a variety of treatment options. Explain what some of those are.
Every patient who comes in to see me has a different problem and they have a different life. And so what we first try to do is identify what are the specific problems. Do we have acute pain? Do we have chronic pain? If we have chronic pain, how long has it been there? What has been tried and failed? I will say that it's quite common that patients come to me after they've seen 3 or 4 or more different doctors, specialists, surgeons. So we try to identify what's the problem, what are the individual characteristics about your particular problem that we really need to focus on and address on an individualized basis. One size does not fit all with chronic pain.
Where can someone go if they want to book an appointment with you, if they want to have a conversation with even some of the other physicians that are available?
Sure. So in Ohio, we have 4 clinics here in Columbus, Dublin, Springfield, and Fairfield. So we have a wide net in the state of Ohio. I also have partners in Indiana as well. We're all board certified physicians with years of experience in interventional pain management. And we have other support team as well. We're happy to evaluate any patient in need. We may not be able to solve every patient's problems, but we can certainly give a comprehensive evaluation and discuss what the options would be.